Let's get right to that deadly and escalating flu epidemic causing so much misery in so much of the country right now. ABC's Lindsay Davis is in one of the hardest hit cities, Boston. Good morning, Lindsay.
Good morning, George. Masks like these and also hand sanitizer, of course, are the front lines of defense against fighting this flu here in Boston and around the rest of the country. But it's not just the flu. There's also a nasty stomach bug called the norovirus that's also on the rise. The fight against this particularly nasty strain of flu is quickly becoming an uphill battle.
I don't remember seeing anything like this here in 20 years.
This morning, hospitals and doctors' offices are running low on flu shots and tests.
This is a true national shortage.
More than 128 million vaccine doses have been distributed nationwide, but with supplies dwindling, clinics simply can't keep up with the growing demand.
Today we should be getting in possibly 30 doses in this location, but that could be gone in 20 minutes.
Across the country, schools are reporting hundreds of students out sick, as some school systems resort to using high-powered disinfectant to clean classrooms. Today in Oklahoma, one district has even canceled classes. 25% of its students are ill. From Minnesota to Massachusetts, states are reporting an increasing number of flu deaths. In New York alone, more than 15,000 cases of the virus have already been reported, more than 3 times the number during all of last year. Michael Mail got a flu and a pneumonia shot, but neither stopped him from making a trip to the hospital.
I never had to strain that hard to breathe. So I was pretty close to death.
Pharmacists are also struggling to fill prescription drug orders.
Right now we're getting 24 boxes of the Tamiflu capsules, but we're getting 40 or 50 prescriptions for them every day.
One doctor I spoke to said what concerns him most is that transmission of this year's flu is faster than normal. And also they have an inundation earlier than usual. Normally they don't have this many cases in the emergency room until flu season peaks in late January or February. George?
All hitting so hard. Okay, Lindsay, thanks. Let's get more on this now from our health and medical editor, Dr. Richard Besser. And so we're learning shortages of vaccines, shortages of Tamiflu, especially for children. So what do you do if you can't find it?
Yeah, I mean, people are trying to do the right thing, which is good. There's a website that can help you. It's called flu.gov. If you go there and put in your zip code, it will tell you the pharmacies in your area that may have the flu vaccine. You may have to work a little harder at it. I talked to CDC this morning about the shortage of the Tamiflu. And if they don't have the child's preparation, the pharmacist can take the adult tablets and mix up a syrup for your child. So that should cover you there.
Meanwhile, as we're so worried about this flu, as Lindsay reported, this norovirus also coming in and just creating so much misery.
I mean, that is such a nasty stomach virus. You know, the last thing you want on top of the flu is to get that. So if you were healthy before you had the flu and you're doing well with the flu, don't rush into the emergency room or your doctor's office because you could pick up something like norovirus. Give them a call and they can help you handle your illness that way.
And finally, there's also a new warning out on this acetaminophen, which is the ingredient in things like extra-strength Tylenol that so many people take.
Right. I mean, just last year, Johnson & Johnson, the leading maker of Tylenol, lowered the maximum dose that you should have in a day of acetaminophen to 3,000 milligrams. And the reason you have to be careful is you may just take acetaminophen for your fever, but you're taking multi-symptom relievers for your other symptoms. Those all contain acetaminophen. So Dayquil, NyQuil, Theraflu,
so it's real easy to hit the limit.
It's so easy. If you don't read the label there, you can get in trouble. And in young children, don't give them any over-the-counter medications without checking with your doctor first. It can be very dangerous. It's a leading cause of liver failure, and that can be deadly.
Okay, Richard Besser, thanks very much.